All right, good afternoon, everyone, and thank you for being here. I want to begin by recognizing the other leaders here with us today and thank them for making this announcement possible. To my immediate right, Chicago Department of Public Health Commissioner Dr. Arwady. To my immediate left, Rosa Escarino, Commissioner of the Department of Business Affairs and Consumer Protection, and Chicago Department of Public Health Medical Director, Dr. Geraldine Luna. Thank you, ladies, for being here with us. I'm here to make several announcements related to our vaccine efforts and other reopening news. First, something important for our seniors. Since the very beginning of our long journey with COVID-19, we've been working around the clock to ensure that all of our residents, especially those who are most vulnerable, remain connected to care and have equitable access to resources that they need to feel safe and healthy. And even when vaccines first arrived in our city almost 3 months ago, we didn't lose sight of this important mission. In fact, we doubled our efforts by accelerating our efforts to push vaccines to residents that need them most, and that work continues. Among those residents are undoubtedly Chicagoans aged 65 and older. As I said on Friday, here in Chicago, we have 250,000 seniors who have yet to get their first dose. And when you take into account all of Cook County, that number jumps to nearly 500,000. In order for us to truly rise above this terrible pandemic, we must get our seniors vaccinated as fast and as humanely as possible. No shortcuts there. It's essential to us to be able to move forward. Because we've seen that in Chicago, regardless of the underlying conditions, vaccinating older residents has the biggest impact on preventing COVID-19 related deaths, as more than 80% of the total number of COVID related deaths in Chicago have been in residents aged 60 and older. And to date, 1 in 3 Chicagoans aged 65 and older have received at least their first dose. This is great progress, but it's not enough. And we won't stop until we reach a much loftier goal, which is of getting every single one of our seniors fully vaccinated. That's why we've come together today to announce that starting this Thursday at 8:30 a.m., again, this Thursday at 8:30 a.m., Illinoisans aged 65 and older will be able to schedule an appointment to get vaccinated at the United Center vaccine site, which will begin to administer vaccines on March 10th. So this Thursday at 8:30 a.m., a very important date to mark on your calendar. And in an effort to bridge the digital divide and further ensure equitable access to the vaccine, residents will now have 2 options for making appointments, and you can see them on the screens behind me. One is online, and the other is through a multilingual call center. To register online, please visit ZocDoc, that's ZocDoc.com/vaccine. That's ZocDoc.com/vaccine. And to register by phone, please call 312-746-4835. That's 312-746-3835. Again, that registration is for seniors via phone or online, and it will begin this Thursday at 8:30 a.m. And we encourage those who have access to the site to go there first and save the phone number for those who may not have access to a computer or some other kind of digital device. Folks, this is an all call to seniors, their family members, or anyone else in the seniors network and support system to get them signed up for these appointments before they are taken. So Thursday, 8:30 a.m., 2 methods, ZocDoc.com/vaccine or call 312-746-4835. Let me once again stress that our only way to fully recover from this pandemic is getting seniors vaccinated as soon as possible. So our residents aged 65 and older, please don't delay in receiving this life-saving vaccine. And to the loved ones of our residents aged 65 and older, please make every effort to help them get signed up for a vaccine appointment, either online or over the phone. and to help them get to the United Center when it's time for their appointment, or we will provide transportation options for them. We must do everything in our power to support our seniors. So let's get them their appointments and let's get them vaccinated. In addition to opening appointments for seniors this Thursday, the city will also host special vaccine events. Let me say that again. The city will also host special vaccine events for seniors across 10 of our communities beginning March 5th and March 14th, which we will provide further details on in the coming days. And starting March 4th, the city will also partner with the Chicago Fire Department to vaccinate homebound seniors enrolled through our Smart 911 and their caretakers. So there are lots of efforts happening in the month of March to make sure that our seniors have access to the vaccine. And March is our senior month. It's SOS, support our seniors. These efforts showcase the endlessly positive impact that come from leaders at all levels of government and from departments of all kinds coming together to provide for our most vulnerable residents' needs. It's in that same spirit of collaboration that I would also like to announce another effort that was made possible by each and every one of our residents working together and doing their part to slow and stop the spread of COVID-19. Today, I am joined by BACP Commissioner Rosa Escareno to announce that we are further easing COVID-19 regulations on Chicago businesses. Effective immediately, indoor capacity at bars, restaurants, and other businesses can increase to the lesser of 50% or 50 people per space. Bars and restaurants can now remain open until 1 a.m. And alcohol sales from liquor stores and other establishments can continue until 11 p.m. That's instead of the 9 p.m. cutoff currently. And indoor fitness class sizes can increase to 20 people. This progress can be attributed to the sustained effort that we have been seeing across all of our reopening metrics because people are still adhering to the public health guidance. It makes all the difference in the world. Dr. Arwady and Commissioner Escareno will speak about these efforts in more detail shortly. And it's a reminder for businesses and residents to keep wearing your face coverings, washing your hands frequently, socially distancing, and to follow all the other public health guidance so we can keep making progress and moving forward in our journey to recover from the pandemic and heal. Each of today's announcements were made possible by the work of countless government and healthcare workers, businesses, community leaders, and of course you, everyday residents. Thanks to your efforts, we are one step closer to putting this pandemic in our rearview mirror. And with that, I will turn it over to Dr. Arwady. Thank you, Doctor. Yep.
Thank you, Mayor. So a lot of good news today. And I just first want to underscore what the mayor said, that the reason we are seeing these improvements in COVID numbers is because people have continued to wear their masks, to socially distance, to do all the other things that have gotten us this far, and because we've continued to see very, very good demand for this vaccine. With J&J now on the scene, we have a third vaccine as part of our arsenal that will be rolling out over the week. Still, we don't have enough vaccine for everybody who wants it, but every day that calculus is improving and underscoring the United Center as a major improvement in terms of our ability to get vaccine first to seniors. So I want to go over some of the data. First, our COVID cases diagnosed per day. We are now averaging in the city of Chicago 283 new COVID cases every day. That's well under the 400 new cases per day where we really want to stay behind. We're still not under 200 new cases per day, which is where we'd like to get, but the numbers are looking good and slowly trending down. Our test positivity is at the lowest it has ever been since COVID got to Chicago. We are today at 2.9% test positivity.
I'm going to clap for that.
Yeah.
'Cause that's a big news.
Absolutely. And that does put us in a lower risk category for that test positivity. We are also in a lower risk category for emergency department visits, seeing just 42 visits a day across all Chicago hospitals with people coming in with symptoms that could be COVID. We don't even wait to get the test. It's one of our quickest ways to look for any signs of trouble. And seeing just 42 people a day with symptoms potentially consistent is the lowest we've seen, again, since COVID got to Chicago. And then finally, our ICU beds. We currently have 103 folks in ICU beds across Chicago hospitals with COVID. We have 27% capacity. Both of those are still in the moderate risk range. But because all of our metrics have remained in the moderate or lower risk range, we are then able to expand to that 50% capacity, which you'll hear about. Just to show you some graphs quickly, this is our cases, and we'll post these online. This is the graph of what the cases have looked like throughout time. You can see the lowest we got was over the summer. We did get under that 200 case per day mark at 177 cases per day. We're at 283 now. We want to get that number even lower. We look at positivity, 2.9%. That is by far the lowest that we've had since we started. We were at 16% at the peak of at the top of our second peak here. We look at emergency department visits, like I mentioned, just 42 a day, the lowest that we've seen since this broke out. This is not dependent on testing. It's one of the most sensitive measures that we had, and it continues to improve. And then finally, our ICU beds. You can see we're at 103 per day. Over the summer there, we were under 80, so we still have a little ways to go. Similarly, our deaths, we're currently averaging 5 to 6 Chicago deaths per day from COVID-19, really equally across all of our race ethnicity groups, consistent with the population breakdown. And still watching this, but things are heading the right way. Here's the deaths data. Related to vaccines, we've now administered more than 630,000 COVID vaccines here in the city of Chicago, more than 520,000 just to Chicago residents. 1 in 8 Chicago residents has gotten at least that first dose of vaccine. 1 in 3 Chicago residents over 65. As you may recall, we set both vaccine efficacy and equity goals here in the city. Every week, we have met these goals. We set a goal of pushing out at least 95% of our vaccine every week. Last week, 98% of our doses were pushed out to providers. Where we hold a little bit back, it's to make sure we can meet second doses on time for everybody across the city. Our other vaccine efficiency goal is vaccine getting into arms. We set a goal that at least 85% of all of the vaccine that we get here in Chicago is in arms and reported 7 days later. In fact, last week, we were at 100% of those doses administered and in arms. We were helped a little bit by those weather-related shipping delays. I think people saw there is not vaccine sitting on the shelf, and in fact, we are getting it into arms just as fast as it gets here. Our vaccine equity goals. Our initial goal is that the majority of Chicago's vaccine will go to Black and Latinx Chicagoans, given that 59% of Chicago is Black or Latinx. Again, last week, for the third week, we had 50% of our first doses going to Black or Latinx Chicagoans. And our Protect Chicago efforts are paying off related to equity as well. As you may recall, we have Protect Chicago Plus, which pushes additional vaccine and extra focus on the 15 community areas at highest risk for COVID and with more barriers to potentially getting COVID vaccine. And where we look across the city, the 5 most improved community areas related to first dose vaccine coverage last week across all 77 community areas, 3 of them, Belmont, Cragen, Gage Park, and Archer Heights, are all Protect Chicago Plus communities. I'll also note that Hermosa, although it is not one of the Protect Chicago Plus communities, it is in our higher risk area related to our COVID vulnerability index. And so as a reminder, it's not just that we push vaccine to these 15 communities. We start where we're thinking about bringing senior vaccines, where we think about bringing strike teams. We work backwards, really, for those kinds of efforts, and really pleased to see those improvements in the parts of the city where that's most needed. And then I'll refer you to the website, chi.gov/covidvax, for more data. But you can see on the maps here, we've got some of our hardest hit parts of Chicago now in those darkest blue, where we've got the most vaccines going to the areas where they're most needed. We still have a ways to go, don't get me wrong, but I couldn't be more pleased with the progress that we are seeing. I also want to highlight that for the first time, where we look over the last month, Chicago's COVID cases are looking like Chicago. We have seen the most COVID cases in white Chicagoans, followed by Latinx Chicagoans, followed by Black Chicagoans. We've not been able to say that for months. And the good news is all of those numbers are heading down in the right direction. We've got more than 540 bricks and mortar providers enrolled across Chicago. These reflect everything from outpatient clinics to hospitals to pharmacies. We don't have enough vaccine to push vaccine to 540 providers yet. But as more and more comes in, we'll be able to get this out. Again, the number one way people in Chicago, including seniors, are getting vaccinated is by their healthcare provider. It's a best practice, and it's one that we want to see continue. And then I wanted to highlight some of the mobile COVID-19 vaccination sites, because in addition to what you're hearing about at United Center, we and our partners have been working really hard to bring vaccine into settings where it's most needed. So already, some of this is through the federal pharmacy partnership, some of this is directly the city of Chicago, some of this is working with partners. But already we've had visits at 79 skilled nursing facilities, 28 assisted living facilities, 91 senior housing facilities, some of those in the federal program, most not, and we have every CHA building booked for a mobile vaccination clinic by March 22nd. We've also done 62 intellectually and developmentally disabled facilities, 9 behavioral health facilities, and more. You've heard us talk about our work bringing to homeless shelters, bringing to domestic violence shelters, bringing to any settings that have been concerned. And in March, we're also going to be doing more of this strike team work with some of our highest risk manufacturing settings, places where we've seen outbreaks. Again, bringing the vaccine where it's most needed. And you'll see on this map here, and we'll put this online, the blue and the black dots represent where we've had appointments. The red and yellow circles are where we were last week. And we've worked hard to bring extra mobile vaccination sites to places where there may be fewer bricks and mortar sites. So more than 110,000 United Center appointments in March will open for booking, as you heard, on Thursday, March 4th at 8:30 a.m. Those appointments will initially only be available for seniors age 65 and older. So you cannot sign up for this today. You cannot call this number today. You cannot register today. Starting Thursday at 8:30 a.m., please go online, sign up for a vaccine if you're over 65. Then, on Sunday, March 7th at 4 p.m., any unfilled appointments would be open to others. So if all 110,000 approximately appointments are not filled by seniors, they would then open, consistent, of course, with CDC guidance that we want to make sure that all appointments are being filled. Again, you already saw, but ZocDoc.com/vaccine is how you book these United Center appointments. And for people without internet access, registration help will be available through this line. The call center will be open Monday to Saturday, 8 a.m. to 8 p.m., and Sunday, 8 a.m. to 4 p.m. I also want to highlight that at the United Center, we're doing a lot of work, again, with all of the partners involved here. As you heard last week, this is federal personnel, lots of work with the state, with the county, with the city, with providers. We have worked to make sure, for example, there is a portion of the United Center for people who have limited mobility. If you need a wheelchair, we can help with that. There will be on-site language translation. If somebody needs to bring a companion with them to help walk them through the vaccine process, you are welcome to bring one companion. That companion does not get vaccinated. The vaccine, again, focused first and foremost on people over 65, but you're welcome to bring somebody if needed. And through a partnership with Uber, there will be, for people who are not able to get a ride, there will be a possibility for 20,000 people to be able to get free Uber rides to and from if they are City of Chicago residents over 65 who need a vaccine. You'll get access to that after signing up through ZocDoc or if needed through the call center. And with that, I am happy to bring up Rosa Escareño, the Commissioner from Business Affairs and Consumer Protection, to talk a little bit more about why this good data means that we are in a place to be able to further do some careful reopening.
Thank you, Doctor. Good afternoon. My name is Rosa Escareño. I'm the Commissioner for the Department of Business Affairs and Consumer Protection. And just 3 weeks ago, Dr. Arwady and I stood here and said that we would announce a pathway towards a 50% capacity for bars, restaurants, and other businesses. And so here we are today. All these great news and projections that have been provided to you are the reason why we are continuing to reopen even more. And so we remain very cautiously optimistic that we are going to continue to see this easing of restrictions. And so today, as the mayor indicated, I am pleased to say that we have reached the established benchmark and are now at 50% indoor capacity or 50, whichever is less. Obviously, this is great news, and to be honest, I didn't expect that we would actually be here so soon. But I think that the wearing of the masks, certainly all these measures to vaccinate our residents across the city and really targeting our areas of need have really helped to make sure that we're all moving in the same direction, including our business community. So as all of these COVID benchmarks and metrics are looking really good, we continue to urge diligence and caution as we continue to reopen. So I just want to say that the numbers are great. I am extremely happy to be here, but however, I do want to make sure that our rush to reopen does not endanger any good progress that we've made. And as all of you know, the painful indoor dining closings that we did just last fall is still, just very, very present in our mind. So I want to make sure that as our business community now starts to open, that they keep that in mind. And so today, as the mayor indicated, we are now increasing the 50% capacity. This includes the bars, restaurants, and events. Again, making sure that they limit to no more than 50 people per room or per space. Larger establishments can divide rooms into multiple spaces with impermeable barriers that are at least 7 feet in height, but within those spaces you must still keep the capacity of 50% or fewer than 50 people, whichever is less. Bars and restaurants can remain open until 1 a.m., and they can also serve liquor until that time. But please note that patrons must all be off-site by 1 p.m. There are no exceptions here. And the food pickup and delivery may continue after 1 a.m., but restaurants must be closed to the public, and again, no exceptions. We will be paying very close attention. Liquor stores and other businesses with packaged goods license can sell alcohol now until 11. As the mayor indicated, we're increasing the time frame from 9 to 11. And again, I just want to caution, and I'm extremely happy that we are moving in this direction, but for any late night establishments or liquor establishments, our enforcement team will be out there. As you know, we have a nights and weekends team. We partner with the police department. So again, want to work with our business community. They've been great partners, but just an added layer of caution here. And then also our fitness classes can continue in those establishments and can increase to 20 people per class, but also the establishment totality must meet the 50% or 50 people, whichever is less, including paying close attention to the distance of a spacing of 6 feet per person inside those workout establishments. And again, keeping our community safe from the spread of COVID continues to be our #1 priority. So what that means for bars and restaurants and all other event spaces is that regulations will remain in place, including the following. The no more than 6 people per table still remains in place, 6 feet between tables. Patrons must be seated while eating or drinking. And bars that don't serve food must have a food partner in order to ensure that they are also being allowed to open with the stated timeframes. And this expansion of capacity cannot be an excuse to disregard the safety regulations. My team, as I've stated, we have very close partnership. We have 2 important initiatives. Our large gatherings task force, which includes multiple departments, including police and fire, that work with us, and the buildings department. So we will be going out there to ensure that these large gatherings are not happening. And then we have our weekends and nights and weekends team that is out until very late into the evening. So want to make sure that businesses understand that we are going to be taking the enforcement very seriously, and we are going to be addressing any of those issues with strong regulation. And then again, I just call on our business community. They've been extremely great partners. Why we are here is not just because the public has been doing the right thing, but our business community, they've been incredible partners. And as they now continue to reopen, I ask them to continue to stay vigilant on these new expansion regulations. And just a brief reminder that since March, we've conducted over 8,700 investigations, and our citations have been just at 5%. So again, we continue to be working in partnership, but now as we begin to open, we have to be much more diligent with keeping the regulations in place. And again, I just want to thank our business community. I want to thank the mayor and Dr. Arwady for their leadership. There's a lot that we're doing to obviously keep our entire city working and moving in the right direction. If you'll just give me another minute, I'd like to repeat these in Spanish for our entrepreneurs of Spanish-speaking language. Buenas tardes, mi nombre es Rosa Escareño y soy la comisionada del Departamento de Asuntos Comerciales y Protección al Consumidor. Hoy me complace decir que el número de casos de coronavirus continúa disminuyendo. Basado en esto, comenzando hoy, podremos realizar el 50% de capacidad o 50 personas por espacio, el cual sea menos para todos los bares, restaurantes y otros negocios. Esta es una muy buena noticia para nuestros empresarios, ya que hemos estado trabajando a bajar esos números y asegurar que nuestras empresas y los negocios pueden abrir más cada día. Pero la prisa para reabrir no debe de poner en peligro el progreso que hemos hecho todos juntos. A partir de hoy, la capacidad de empresas ahora puede aumentar al 50%. Esto incluye los bares, los restaurantes y los eventos. La capacidad total permanece limitada a no más de 50 personas por habitación o espacio. Los bares y los restaurantes pueden permanecer abiertos hasta la 1 de la mañana y también puede servir el licor hasta la 1 de la mañana. Pero todos los clientes deben estar fuera del establecimiento a la 1 de la mañana. No va a haber excepciones aquí. También podemos asegurar que las licorerías y los negocios que venden productos empaquetados pueden vender ahora alcohol hasta las 11 de la noche. Estos eran los establecimientos o las licorerías que tenían que cerrar a las 9. Solo hasta las 11 de la noche, también no excepción. Las clases de gimnasio pueden tener ahora 20 personas y el establecimiento debe cumplir el 50% del límite de capacidad. La prioridad número 1 es asegurar que estamos protegiendo a nuestra comunidad del virus COVID. Esto significa que los bares, restaurantes y eventos todavía tienen que seguir los reglamentos de no más de 6 personas por mesa, 6 pies entre cada mesa, y los clientes deben estar sentados con la mascarilla cuando menos cuando están comiendo o bebiendo. Los bares que no tienen licencia de vender comida deben tener una relación con un establecimiento de comida para poder tomar ventaja de las horas de alcohol. Y les quiero dejar saber que no deben de ignorar los reglamentos. Mi equipo va a estar trabajando con el Departamento de Policía y otros departamentos para asegurar que los reglamentos están firmes y están vigentes en cada establecimiento. Desde marzo hemos realizado más de 8,700 investigaciones con fianzas de solo el 5%. Pero les quiero dar las gracias a los empresarios y decirles que por su ayuda hemos podido seguir progresando, y les doy las gracias al alcalde, a Lori Lightfoot y a la doctora Arwady por todo lo que están haciendo para proteger a nuestra ciudad. Ahora quiero darle la bienvenida. Now I want to welcome Dr. Luna from the Chicago Department of Public Health. Thank you.
Muy buenas tardes a todos. Nos hemos reunido para compartir excelentes noticias. A partir del jueves 4 de marzo a las 8:30 a.m., los adultos mayores de 65 años podrán programar su primera cita para la vacunación del COVID-19 en el sitio de vacunación de United Center, que comenzará a administrar las vacunas el 9 de marzo. Desde este periodo de citas exclusivos para personas mayores, todos los residentes de Chicago elegibles bajo la fase 1A están suscritos o pueden suscribirse para recibir sus citas y pueden programar citas el domingo 7 de marzo desde las 4 p.m. El sitio de United Center tendrá la capacidad de administrar 6,000 dosis por día. Es un centro de vacunación masiva. Y todas las dosis serán proporcionadas directamente por el gobierno federal y no se tomarán de las asignaciones estatales y municipales. Eso es excelente noticia. La vacuna se ofrecerá sin costo. Y no se requiere seguro médico ni se solicitará en el centro de vacunación de la comunidad algún tipo de documentación que ponga en riesgo a ninguna de nuestras comunidades vulnerables, como nuestros indocumentados, nuestros miembros sin aseguranza, nuestros miembros sin hogar. Tampoco se requiere documentación del estado migratorio, como ya les mencioné. Los residentes de Chicago tienen 2 opciones para programar sus citas. Lo pueden hacer vía electrónica y a través de llamadas. Para registrarse en línea, visite ZocDoc, Z-O-C, D de dedo, oc.com/inclinada. Vacuna, en inglés, vaccine, V-A-C-C, I de puntito o I latina, N-E. Y ahí puede conseguir bajar la aplicación electrónica y suscribirse a sus vacunaciones. Se prevé que el sitio web maneje un volumen mucho mayor de solicitudes de citas. ZocDoc mostrará la disponibilidad de citas en tiempo real y los residentes elegibles podrán seleccionar una fecha y hora para reservar su cita en línea. Se requerirá la fecha de nacimiento para reservar cita para confirmar la elegibilidad de la vacuna en este momento. Para registrarse por teléfono, por favor, tome nota. Llame al 312-746-4835. Para poder ayudar a cerrar la brecha digital, habrá un centro de llamadas multilingüe disponible para ayudar a las personas mayores a programar una cita. Este centro de llamadas estará disponible a partir de las 8:30 a.m. el jueves y luego de 8 a.m. a 8 p.m. todos los días. Dada la alta demanda anticipada de citas, los residentes pueden usar el sitio web para reservar sus citas en línea. Si bien el sitio de llamada tiene 200 empleados, es muy probable que aquellos que necesiten usar el centro de llamada experimenten un tiempo de espera. Por favor, sean pacientes porque está ocurriendo y son muy buenas noticias. El sitio operará los 7 días de la semana durante 8 semanas bajo el programa piloto de vacunación del gobierno federal y se asignarán más de 100,000 dosis para la operación. La instalación será administrada por la Agencia Federal para el Manejo de Emergencias, con el apoyo del Departamento de Defensa del Estado de Illinois y también del Estado Cook y la ciudad de Chicago. Vacunar a nuestros adultos mayores lo más rápido posible y fundamental. Es fundamental para nuestra capacidad de superar la pandemia como ciudad y como Estado, como bien lo dijo nuestra alcaldesa, Lori Lightfoot. Este sitio de United Center aumentará significativamente la capacidad de vacunar a los habitantes más vulnerables de Chicago y garantizará aún más el acceso equitativo a las vacunas. Tenemos también más buenas noticias. Este mes de marzo, estarán ocurriendo eventos durante la semana de nuestros residentes de mayor de 65 o más, que se llama el Senior Week. Tendremos 11 eventos ocurriendo y más información para darle al público. Estén muy atentos. Se le van a estar dando servicios a comunidades altamente afectadas por el COVID fuera de las 15 comunidades protegidas por la iniciativa de Chicago Protect Plus. Gracias a todos. Y gracias a nuestra alcaldesa y a nuestra comisionada Dr Arwady y la comisionada Escareño.
I think Dr. Lunar said that she would answer all your questions.
Can we just clarify, first of all, and I have several questions from others, not just mine.
Yes, understood.
But just to clarify a couple of things. We're going to start March 5th rather than the 10th, is that correct?
We're going to start with the registrations. I think Thursday is March 5th, or Thursday's March 5th?
Thursday's March 4th.
Thursday's March 4th.
Oh, it's
So Thursday morning, 8:30 is when the appointment portal will open.
But the shots in the arms begins when?
March 10th,
Still on March 10th.
yes.
110,000 people for the total. Do you envision United Center open for a finite time? Is it 8 weeks, or do you think?
Yeah, I think it's about 8 weeks.
And if
And
it's-
again, keep in mind, it's going to be in parking lots, not in the
Right.
physical center itself. It's going to look kind of like a little bit of a tent for walk-ups, but also we're going to accommodate drive-through as well.
110,000 people you hope to reach during those 8 weeks. If Dr. already went over this a little bit, but if you could explain it again about, okay, so seniors don't, not enough seniors, but you've got shots to give. How about other people? What should they do besides the seniors?
Yeah, the registration exclusively for seniors will start on Thursday morning at 8:30. That will close at 4 p.m. on Sunday. And our hope is that 10,000 of those slots, given that we've got about 250,000 seniors to get vaccinated, that those will be taken by seniors 65 and older. In the event that that's not the case, then the appointment portal will open for others.
After Sunday.
Correct.
And will that just stay open, or is that going to be just?
Well, there's 110 slots, so 110,000 slots.
And then when people don't show up, might people just sort of be hanging outside the United Center?
Well, our hope is that people will actually keep their appointments. It's going to be difficult if people don't show up to be able to transfer that, but maybe I'll let Dr. Arwady go into the finer details of that. But our goal is get people signed up, have all sorts of opportunities for them to be transported to the site in the event that they don't have their own transportation. So we're going to be following up with folks. We want to make sure that we make full utilization of this really important contribution that the federal government has brought to us that's separate and apart from our normal vaccine allocation. We're one of few locations across the country, so we want to make sure we take full advantage of it. Dr. Arwady.
Thanks. I would just highlight those 110,000 appointments are really what we expect to have available in the month of March, really in the first 3 weeks that the site is operating. Because we're using Pfizer vaccine at this site, we think about people needing to get that second dose 3 weeks later. So the idea is we'll do 3 weeks of appointments, open that whole block up right at the beginning. So that whole first 3-week block opens up again, open first for seniors, and then if they don't fill, it would open more broadly than that. We'll do the 3 weeks first dose, we'll do the 3 week second dose, and then we'll be moving on from there. We're hopeful that there will be even more vaccine really by that point, and our focus was to really make sure, again, we can get seniors covered in the month of March.
And then will the United Center also be able to be available to everyone under the state's 1B? Even though the county and the city hasn't been able to do that yet.
Yeah, so let me address that. So that really has to do with whether the appointments fill. So the idea is, of course, everybody wants to make sure that every appointment gets used. And we do have lots of plans related to wait lists. One of the reasons we like ZocDoc is that you're able to very quickly repost appointments if there are people who don't show up for appointments. There's also the ability to confirm appointments and make sure that people are still needing them. And one of the reasons that we're not starting people signing up until Thursday is that we have a lot of these other efforts happening for seniors. So the idea is we're still really on track to be able to move ahead in Chicago. Our plan is to move ahead likely at the end of March, as we have been planning. We may be able to move sooner than that. It depends on what our vaccine supply is like and how things move from there. So the idea is we start Thursday, Friday, Saturday, Sunday, 110,000 appointments available. Only open to people over 65 who live anywhere in Illinois. If those 110,000 appointments don't fill, great. We would then open them up to people who are in that 1B plus category.
How on ZocDoc are you able to prove someone is at least 65 years old?
So people do need to put in their date of birth. As a reminder, we are keeping track of people's vaccine records at the state registry level, and particularly where we think about, down the line potentially needing to show that your proof of vaccination for various reasons. Date of birth is one of the things that we always collect, and that will be one of the things that is screened for as people are signing up.
WBZ is also asking, are you doing outreach to seniors who don't have savvy children who can help them?
Yes.
Can you give an example?
Sure. So, again, this has been coming together fairly quickly, and we wanted to make sure the details were there. But we'll be working closely with the aldermen, with all of our community groups, with faith leaders. One of the reasons we really wanted to keep that appointment time open through Sunday was that offering, if the appointments are not all filled by then, really thinking about that weekend time when religious groups may be gathering and encouraging them to also think about ways to help get their seniors signed up. We are doing a lot of matching related to where there are volunteers and people who may have the possibility to sign up. But one of the reasons we're talking about this before the ability actually is there to sign up is that we really want to get this news out, that Thursday morning, 8:30 a.m. is when this opens. And if you know somebody, if you have a neighbor, if you have an aunt, if you have someone, who's over 65 who hasn't been vaccinated, please do that outreach right now and say, can I help you make that appointment starting on Thursday? That'd be great.
Health News Illinois is asking, does Chicago have the authority to delay second doses? If so, given increasing evidence of the effectiveness of one shot of Pfizer coupled with increasing concern over variants, is doing so something the city is considering?
So the city of Chicago absolutely has and will continue to follow the FDA and the CDC guidance and authorizations on all things related to vaccine. These trials, as you know, were done for both the Pfizer and the Moderna as 2-dose vaccine trials. That is how they are authorized for use right now. That is how the CDC recommends them for use. And that is, in fact, how the city of Chicago and all providers, when we sign the acceptance agreement to be able to receive vaccine from the federal government free of charge, and that is the only way you can receive vaccine, you do sign that you are going to follow that guidance. So we will not be changing. There's certainly, as we see how well these vaccines are performing in the real world, which has been amazing, if there's a possibility in the future that that could be a recommendation, we would follow that, but we would always follow the recommendations of the FDA and the CDC on that.
Chicago Tribune asking, with additional vaccine coming to Chicago, is the CDPH also considering moving restaurant workers up from phase 1C to phase 1B?
So we still have, as you've heard us say, about 500,000 people still to get done in that existing phase 1B. And about half of them, even just here in Chicago, are people over 65. Look, our goal is to get these highest risk individuals in terms of hospitalizations and death and these highest risk settings vaccinated. I think the numbers in a lot of ways really speak for themselves. The fact that we've been doing, I think, quite a good job of pushing vaccine to the settings where it is most needed is a big part of why we are seeing real improvements in some of the areas that have most driven this. So restaurant workers are in 1C, and one of our decisions around perhaps not even doing a 1B plus. We'll see where we are a little bit. But in terms of opening things up, we want to make sure that there is access for other essential workers. And again, we've been estimating that that would come starting approximately March 29th, that last Monday in March. We'll make adjustments to that, as we always have, as we see how vaccine doses come in. But honestly, the way they've been coming in is about how I've expected them to come in. March is going to look a lot better than February did related to vaccine. And I think April's going to look a lot better than March. So the numbers keep going up, but at this point, we are not changing any of the eligibility criteria.
Marianne, let's do one more from you on that.
I've got like from other people, so they're not just my questions.
Can we do the room as opposed to people who don't come?
Go for it.
Go ahead, Frank.
Mayor, on restaurants, if we could, we're hearing from some restaurant owners that are saying, great, we appreciate moving towards 50%, but if we're a larger room and we can still only have 50 people, it really isn't doing anything to help them. Is there any possibility of moving to larger numbers so that they can actually make a little bit more money?
Here's what I say about that. we certainly understand and are in regular conversation with the restaurant industry through their trade association, but also through individual restaurateurs. And what I consistently say to them is this: I understand there's a great desire to essentially open back up as fully as possible. I get that. This has been a horrendous year for restaurants and bars. But what I also know is I've watched very carefully what's happened in other parts of the country where they've opened up very quickly with very high percentages, and what happened almost every single time? They had to close. I want Chicago restaurants and bars to stay open, period. And so we are taking a much more cautious approach. I know that that doesn't sit well with some folks, but I'd rather be slow and steady and continue to be open than throw open the gates to appease a certain segment and then see our cases explode, see our percent positivity explode, and then have to shut it down for a third time. I don't want to do that.
Any potential movement for sports fans and sports? Any update on that?
No,
Cubs games, Sox games.
not at this time, but I think there will be a point sometime this season where you'll see fans in the stands at both Wrigley and Guaranteed Rate Field, which I still call Sox Parks.
There are people going already in New York. You can't tell folks that maybe you'd be there in April or May.
What I've said before is that we're in discussions with both of the sports teams. I think they've come up with very good plans. And when we are ready, we will announce what the future will look like for the potential of spectators in the stands.
All right, let's give Megan the question. Mary, can you give us
Thank you. No worries. Actually, both of my questions are for Dr. Arwady. That's okay. Last week, the director of the CDC cautioned local governments things are tenuous. Now is not the time to relax restrictions. Curious your thoughts on that. Do you have fears of a backslide? Obviously, she's cautioning about that.
Yeah, so, I was on a call with the director of the CDC over the weekend. Certainly, we are pleased to see the CDC playing a more vocal role in terms of giving guidance across the country. I think the largest part of that concern is that we are seeing states really start to think that COVID is just over, talking about dropping mask requirements, talking about not having any limitations in place at all. And, here in Illinois, we are 40th out of 50th states when we think about the number of cases that we're having per 100,000. And actually, if Chicago were a state, we would be 49th in terms of the number of cases that we're seeing per population. We are at a point, we wouldn't be doing this if we felt that making, again, these small turns of the dial are safe to do as long as people keep doing the things that we know work. So certainly I'm aware of that, and I am glad overall. I want to really highlight to everybody that we are not done with COVID, and it is not the time to say no more restrictions, but it is the time, at least here locally, to make those gradual adjustments, and that's why we're doing that.
All right, this will be the last one.
Okay.
We'll give Marianne a couple more. I think she's
She's getting all the pull
handling
ones.
the
I
call
feel
for
bad.
you. Yeah, so
Okay.
don't make me regret it, though.
The last one was that we're hearing cases where facilities have thawed vaccine ready for patients who then fail to show up for their appointments. What is the city's guidance for those facilities? What should they be doing with the vaccine that might,
Sure.
have the potential of spoiling?
And let me just highlight again, because I feel like the question I actually get the most often is about, is vaccine being wasted? And it is not. When you thaw Pfizer vaccine from the ultra cold, you have 5 days to use it. And when you thaw Moderna vaccine from the freezer, you have 30 days to use it. And so we actually look at how many days, even as at the city level where we're pushing out vaccine, we will push the vaccine that has 1 day of use left on it to sites that we know will use it all at the beginning of the day. There's a lot of that kind of behind the scenes sort of planning that goes on. Where we talk about really unused vaccine or the potential for, quote, wasted vaccine, it would only be when a vial has been punctured. Pfizer vaccine has 6 doses in it. Moderna has 10 doses in it. So when you puncture that vial at the end of the day, you could have a maximum, say you had one person left in line and you punctured that, you might have 9 doses of vaccine that you then need to make sure are going to someone. We absolutely have set best practices where we ask people to ensure that they have wait lists available. Putting appointments back up on ZocDoc is certainly an option where we know that these turn around very quickly. But also, for example, like out of our own city of Chicago pods, we have used the opportunity to vaccinate the workers or the volunteers who are working at the pod at the end of the day. And this is some of where the work will be happening with Chicago Fire Department to bring those small number of unused doses at the end of the day to some of the homebound residents in Chicago. So there's a lot of planning, but I want people to hear that there is not wasted vaccine. There are not hundreds of doses. And we really are, the way we allocate vaccine in Chicago and the way people pull vaccine out of the freezers only on a week-by-week basis. We provide vaccine where people are able to say, here's how many appointments I have for this week, and they've got to show that they've been using 85% or more of their appointments each week. So we have a lot behind the scenes going on. We are not wasting vaccine here in Chicago, and we are doing, I think, a very good job of making sure that vaccine is getting to the people where it's most needed.
Do you know anything about the Advocate Aurora announcing a vaccination site near Wrigley Field?
Thank you. I would just say that, we encourage all of our providers to bring vaccine out of the clinic and into the community. We see many, many of them doing that. We particularly encourage them to do that in parts of the city that are in the higher COVID vulnerability index, but we're thrilled to see them do that everywhere. So what happens is that we don't typically have enough vaccine at this point to be able to over-allocate vaccine. So if Advocate Aurora decides to use some of its weekly vaccine doses, and we've seen a lot of providers doing this, saying, I want to host a church event, I want to host a community event. When they're doing that from their existing vaccine supplies, we absolutely love it. We are able to provide some additional vaccine, particularly for those Protect Chicago Plus initiatives. And as more vaccine gets here, I think you'll see even more of that. It's not a matter of not being able to have locations or capacity to vaccinate. It's just been the amount of vaccine holding us back.
Thank you. Off topic, Mayor, a question about the hunger strike and the folks from General Iron who are upset about the talks with your office. What's the latest you can give them as far as meeting and talking to them?
Look, I certainly understand that the RMG application has created a lot of concern in that Southeast Side community, despite the fact that that company has been there for decades, as I understand it. We announced new regulations for large recycling facilities some time ago, and Dr. Arwady and her team are following those regulations. There has already been a significant amount of time for members of the public to weigh in, and I believe that there'll be a significant amount of time for additional comments from the public. But having set forth what the guidelines are, how we're evaluating it, making sure that the technical aspects of that permit application have actually been met, in addition to literally, I think, the thousands of comments that have been received already, the CDPH team is hard at work. My team has been in contact with representatives of the folks that have been on this hunger strike. I sent them a letter directly addressing, I think they had 10 points last week. We are engaged with the US EPA, also with HUD. So we're trying to make our way through this process, recognizing that there's a lot of emotions all around this because of the history on the southeast side of the city, and we're trying to be as responsive and respectful as we possibly can be.
Last question that I have is that from Bill Cameron: does Governor Cuomo deserve re-election?
I was waiting for somebody to ask me that question, right? Look, I'm not there in New York, and ultimately that will be for the voters of New York to decide. What I can say is this. Every woman who has been sexually harassed in a workplace setting, as I have been, understands how difficult it is for a woman to come forward and to speak her truth. And I think now what we've seen with now 3 women who have come forward, and the fact is that It looks like the New York Attorney General will conduct an investigation, and I think that that's important. I'm concerned about the allegations that have been made, from the latest statements that the governor has made, it sounds like there's a recognition on his part that he said and did some things that were inappropriate. But that will be for the New York Attorney General to sort through as she conducts her investigation. But certainly it's concerning. Just before I came here, I heard comments made by New York City Mayor Bill de Blasio. We are way past time in this country where any kind of behavior that looks like that should be acceptable. Part of the challenge is that while we have opened up opportunities for women in the workplace, we've opened up opportunities in institutions made by and for men. So I think this provides us with another opportunity to really rethink what our institutional culture and structures are, because women live a different life in this country than men do. And I don't want to make an overgeneralization, but I think it holds true. And no woman should have to worry about going into her workplace to do anything other than do a good job. And doing a good job shouldn't be measured by her perceived beauty or lack thereof by a man in the workplace, and certainly not by somebody who holds the kind of power that a governor does or any kind of supervisor. Young women in the workplace should just be able to go and do their job and not have to worry about being put into the kind of uncomfortable circumstances that way too many women, and myself included, have experienced in the workplace. It just shouldn't happen. And this is, I think, a powerful lesson on a very public and national, if not international, platform that sexual harassment cannot be tolerated in the workplace by anyone. So there's a lot of questions that I think have to be answered there. The fact that one of the young women immediately made a report to the chief of staff, a woman, and to the special counsel, also a woman, and that the solution was to move her to another job, I think that raises some serious questions. Thank you.
Thank you.